Hello, my name is Dr. Farman Ali and I'm a GP family physician. Today I will be talking about ear infections. There are two types of ear infections. One is called otitis externa or external ear infection, and the other is called otitis media or middle ear infection. Today we talk in more detail about otitis media. So what is otitis media? The ear canal is divided into two parts. The outer ear, the external ear canal, which is the part before the eardrum. The middle ear is the part of the ear that exists beyond the eardrum or behind it. You may hear the term acute otitis media, which refers to the infection of the middle ear. It's more common in children than adults. So how does this infection occur? The space behind the eardrum, or the middle ear as we call it, is normally filled with air. It is connected to the back of your throat by a tiny channel called eustachian tube. It contains 3 hearing bones. The middle ear space is filled with air, but occasionally it may become filled with a fluid. It typically occurs when you have a cold. The mucus then becomes infected by germs. It could be either viral or bacterial, and this leads to acute otitis media. Children with glue ear have mucus permanently trapped behind the eardrum, and this makes them prone to recurrent middle ear infections. So what are the symptoms of middle ear infection? Ear pain, earache is most common, but does not always occur. It is caused by having a tense and inflamed eardrum. Dull or muffled hearing may be present for a few days, and it can last after the infection has cleared. High temperature, fever is common. Children may feel sick or be sick actually and start vomiting and feel generally unwell. Young babies may become hot and irritable. Remember, a hot crying baby should be checked for middle ear infections. Sometimes eardrums burst, perforates, and this lets the infected fluid, the mucus, out and often relieves the pain. This ear pain will suddenly become better, but the ear is now runny, sometimes for a few days. Most of these perforations will heal by themselves. The perforated eardrum usually takes approximately a few weeks after the infection to heal completely. So what are the investigations for the middle ear infection? Usually it does not require any investigations, except that your clinician will look into the ear canal, which is called otoscopy. Most ear infections get better without any treatment. Commonly the doctor may advise a wait and see approach for 3 days. This is because many of these infections are caused by viruses and do not require any treatment or antibiotics. Recovery usually takes place between 3 days and a week. During that time, you can use paracetamol or ibuprofen for adults, and Calpol should be used according to the recommended dosage for children. Drink loads of fluids. Keep well hydrated. Most of the ear infections don't need antibiotics. Many parents would ask whether the child needs antibiotics. Remember, antibiotics are not without their side effects. They include diarrhea, rash, and they may get rid of the friendly bacteria in the gut. Antibiotics are unlikely to help in otitis media or middle ear infection if the child is 2 or more than 2 years of age. If the temperature is less than 39 degrees Celsius, if the child is not severely distressed, or if your child has been unwell for less than 3 days. Antibiotics may be prescribed in certain situations by your GP or the practice nurse. This is the case when the child is under 2 years of age and the infection in both ears. If the child or the young adult has a discharge coming from the ear, if the infection is severe, if the infection is not settling within 3 days, or if any complications develop, or if the child has another medical underlying condition which may increase the risk of infection, such as diabetes, immunocompromised, or if their spleen has been removed, they may require antibiotics and the clinician may prescribe those. So what are the complications? It is common for the fluid to remain behind the eardrums even after the infection has cleared up. This may cause a dull or muffled hearing, as I said. This usually clears within a week and does not require any further treatment. Sometimes the mucus does not clear properly and a glue ear may develop, especially in children. Hair may remain muffled or dull. Repeated ear infections can occur, for example, due to having several colds in a row. It can lead to a glue ear. You should consult your doctor if the dull hearing persisted after the infection has gone and more than a week has passed, or if your child is having hearing difficulty. Rarely a serious infection of the bones behind the ear may develop. This is called mastoiditis, which is the mastoid bone behind the ear. This is a porous bone and the infection, once it sets in, it's difficult to treat. If there is any tenderness behind the ear, please consult your doctor and your doctor may refer the child for further treatment. So, in summary, consult your doctor if the child with earache suddenly becomes unwell or significantly more ill, has an illness which seems severe to you, does not improve over 3 days, or has a temperature more than 39 degrees Celsius. Glue ear. Most children will have at least a couple of ear infections before they reach the age of 5. These are caused by viral infections and does not require antibiotics. If the infections are very frequent, a specialist may advise the insertion of a grommet into the eardrum. This is the same treatment that we use for glue ears in general. A grommet is like a tiny drainage pipe that helps the fluid to escape from the middle ear and lets the air in. Some research suggests that this may reduce the number of recurrent ear infections. Thank you very much.